My name is Ahmed Qindeel. I'm a professor and chief of general endocrine oncological surgery at Tولين. My practice focused on endocrine surgery related to thyroid and parathyroid diseases mostly. Now with the ablation technologies, we are treating more and more patients and helping patients to avoid surgeries and the need to be on thyroid hormone medications. The history is very fascinating. We started with benign, then we started to talk about functional nodules to just small cancers, microcarcinomas, and then now larger cancers, and now metastatic ones to the lymph nodes. It's just fascinating how this is evolving. The indication keep expanding and expanding, and the contraindications are just becoming less and less. And we looked at the data and we did our own meta-analysis very carefully. It showed that maybe up to 99% of nodules that are cancerous, proven to be cancerous, less than a centimeter, will vanish, will disappear, complete disappearance and treatment with the ablation. That's different from nodules from a centimeter to 2 centimeters. There will be less disappearance rate, maybe up to 70%, but over 95% or so will shrink. When we treat patients with small cancers, we want to make sure that we burn the nodule and burn the surrounding tissue very well. What does that mean? We usually focus on providing more energy to the nodule. We stay longer there to get more joules. The more heat we generate in the nodule, the more response and volume reduction rate that we accomplish. But also you want to make sure you understand what's going to happen. What's very well documented in the literature and what we saw in experience, in the first few months after burning cancer, you will see a completely different picture. It actually looks like it did increase in size, it did grow because we burned the tissue around it and looks worse. In benign nodules, you expect the best outcome to start to happen by 6 months, and some of them can continue to shrink up to a year for benign nodules. For cancerous nodules, your best outcome will happen by a year after the ablation. So this is very important to understand. I also have a protocol in my practice that in 6 to 9 months, ideally in 9 months at least or so, I would like to repeat the biopsy after the ablation. And it's fascinating to see that there is no remnant cancer cells. This is something that we can offer now instead of active surveillance and instead of just watching it. If we intervene with radiofrequency ablation, we can go in and burn it and make it disappear, not just to keep the cancer inside and hope that nothing will happen. With radiofrequency ablation, most patients will have no pain afterwards, except it's a very large mass, it might be an issue. But with steroids or with some preoperative medicine that can make them feel calm, or with preoperative sedation, the pain is significantly less in these patients.